Hello everyone. My name is Simiran Choudhary and I'm delighted to welcome you all to today's special session titled Think Pink, Act Now, Screen, Fight, Win. Organized by Voice of Healthcare and proudly supported by Cadila Oncology to mark the occasion of International Women's Day 2025. As we celebrate the strength, resilience, and remarkable contribution of women across the globe, it is equally important to shed light on critical health challenges faced by women, one of them being cancer. This session aims to emphasize the importance of early detection, routine screening, timely treatment, and creating widespread awareness to improve cancer survival rates among women. And today we are truly honored to have with us Dr. B. Nanditha Sesikeran, Consultant Clinical Oncology at AIG Hospital, Hyderabad, a highly esteemed expert dedicated to cancer care, patient advocacy, and advancing the treatment protocols with her exceptional expertise and unwavering commitment. Dr. Nandita has played a pivotal role in transforming cancer care by ensuring timely diagnosis, personalized treatment, and compassionate support, ultimately improving patient outcomes and the quality of life. Welcome to our show, Dr. Nandita.
Thank you. It's a pleasure.
Thank you so much. In today's session, we'll discuss early detection, breaking screening barriers, advancements in cancer care, and how women can take charge of their health. So, with this conversation, our goal is to inspire awareness, encourage regular checkups, and reduce the fear of cancer. So, without further delay, I would like to start with our conversation. So, Dr. Nandita, first, I would like to know why is early detection so critical in improving cancer survival rates? Can you share any real life cases where early diagnosis has made a significant difference which you have witnessed?
Okay. Like any person who treats cancer always says, early detection is the key to cure cancer. Not just women-related cancers, but any cancer for that matter. The earlier you detect it, there are two different things. One aspect is obviously the cure rates, the survival rates are significantly better. And the other is the intensity of the treatment as well significantly reduces when you detect it in an early stage. For example, in breast cancer, if someone gets detected in, say, a very early stage one, their survival rates are generally estimated as 5 year survival rates. So the percentage of women who, with this particular stage, are still alive at 5 years. And in stage one breast cancer, that reaches very close to 100%. So it's in the range of 98, 99%. So that, I mean, very obviously means that earlier the stage, the better. And if you compare that with, say, stage four breast cancer, you find that the survival drops to something like 20, 30%. And that as well differs based on the type of breast cancer. So very obviously, there is a benefit of picking it up early. And to quote an example, I had a patient who had a fairly locally advanced breast cancer, about a stage three or so. And then she started coming for her treatment. She required chemotherapy, surgery, radiotherapy, etc. And she used to be accompanied by her sister for most of these treatment sessions. So one day while the patient was just waiting for her treatment, I kind of just had a chat with the sister as well and said, you're also at the age that you need to be screened. Why don't you just go and get yourself a mammogram as well? And fortunately and unfortunately, she got detected as well with a breast cancer, but it was very, very tiny, not palpable even, just a tiny speck on the mammogram. And she just got away with a tiny surgery and 5 sessions of radiation and hormone tablets, as opposed to her sister who was doing all of these treatment over months and months because of being diagnosed at a much advanced stage. So I think that exemplifies that early stage detection is very, very important.
That's a very great example that how it got detected at an early stage and how quickly the treatment got over. The complexities were very less. I think that's what we want to communicate. How early detection can help detect cancer at an early stage and how simple it becomes to get a treat. Doctors are also have many other options, many things, and patients also don't have to worry much about this. So yeah, I think that's a very good example to motivate our audience. But still, we know there are many barriers which prevents women from going regular screening, that is mammograms, pap smear, or genetic testing. So how can we break this barrier, especially in the rural or underserved communities where this awareness and education is much lower?
So yeah, I think traditionally and in our Indian culture, women always take a back seat when it comes to themselves. They hardly ever prioritize themselves because that's kind of been our culture. So an inherent kind of primary change in our thinking and culture is very, very important. And awareness as well, such as, the way we are doing this right now. Hopefully it reaches somebody who's sitting in some village who will possibly think differently from now on. And apart from just cultural barriers, also when it comes to women associated cancers such as breast cancer or cervical cancer, women think it's a bit of a taboo to go to a doctor and talk about these things. Let's say she has to even talk to her husband to say, okay, I need to see the doctor for this. It's there's so much of a cultural barrier that they don't. Whereas if let's say she has a cough or she has a headache, she's much more likely to go and see a doctor. But to say, okay, I have a lump in the breast, or I'm having bleeding from my vagina or white discharge, it's a lot more difficult for a woman to communicate that to her family and seek medical attention. So in our case, I think opportunistic screening and opportunistic education is very important. So if a woman goes to a pediatrician taking her child along with her, or goes to a gynecologist while having an obstetric checkup, these are the doctors or the healthcare givers who have great power in their hands to educate these women in an opportunistic basis, and also talk to them about screening. And at the grassroots level, if men change their attitude, if they become more aware of women's problems, then and educating men, in fact, that I think will translate in the long term in changing those attitudes and cultures, and making women more forward thinking, and bringing them to the hospital sooner than expected.
You said it right. We do not much talk about what is going through in our body, whether it is related to breast, cervical, or ovarian cancer, as we're talking about. But when it comes to cough, sneezing, and everything, we know what to take medicine, which doctor to go, and everything. So, but if I have to ask that, if someone, a female, is listening to this session and they really get this. The example you quoted is a very good example, and they really want to visit a doctor for the screening. So which doctor should they go? What steps from the start they have to follow, as the awareness, like we are talking about, is not there, where they have to go, which doctor should they take consultants, and how they should proceed with the regular screening. So if you can guide us for that.
So for women in general, there are three cancers possibly that we can screen for. The earliest age-wise would be screening for cervical cancer, and then comes breast cancer, and then you have bowel cancer as well, which is common for men and women. So for cervical cancer screening, it starts around the age of 25. Breast cancer screening around the age of 40 to 45. So if they have to go to a doctor and establish some sort of contact, I think their local gynecologist, or if they're in the villages, even primary healthcare physicians are trained to do pap smears, and so on. So establishing that contact, and then once you start doing your pap smears, you start going to them regularly. Every 3 years, you have a regular pap smear, and then once they get to that age of 40, the doctor just needs to tell them that, see, you've had your pap smears, and then from this age onwards, you are at risk of breast cancer as well. So we'll throw in the mammographic screening as well. In many countries, such as UK or US, the government itself has national screening programs. In India, unfortunately, it's not as extensive. In certain pockets, some governments have really taken this as a challenge and instituted screening, regular screening. But it's always been in the form of kind of pop up camps. but it doesn't like happen on a regular basis. So let's say there is a woman who's had a pap smear this year as part of a camp. 3 years later, she needs to be reminded to go and get another checkup done, and that does not automatically happen. So in our country, the person themselves, the woman themselves, needs to take responsibility for her health. She needs to mark out in her calendar or set some kind of a reminder that she needs to go and get this done for herself. But the first point of contact, yes, could be just a primary health care physician or even a gynecologist who can guide them to get these screening tests done. And then, of course, bowel cancer screening starts after 45. You can get a colonoscopy once in 10 years. We do have mobile colonoscopies, mobile mammogram buses, and pap smear buses as well, which are initiated by a lot of NGOs. So that could potentially be a way for someone to get checked, but don't wait for that to come to you. If it comes, then it's well and good. Otherwise, just go to your nearest town and get those tests done as and when needed. And if the primary healthcare center doesn't have all the facilities to do a mammogram, they can do a pap smear and then be in touch with the next secondary care level center there for the appropriate screening test.
Thank you, Dr. Nanditha, to shed light on how to proceed and when to go to a doctor if it comes to some particular cases of cancer, which we are discussing, because this awareness is not there. And through this session, we want to create that awareness. And as we're talking about the screening and detection of cancer, I believe there's some role of family history also in determining it, like the case study you just explained to us. So, how can genetic testing help in this proactive healthcare, approach to detect cancer at an early stage, and how can we motivate it?
So genetic testing and family history plays a major role in, I would say, breast cancer and ovarian cancer. Cervix cancer, not so much because it's mainly related to the HPV virus. In breast cancers, we find that almost 5 to 10% of breast cancers are associated with a specific genetic hereditary mutation. Some of the commonest mutations are BRCA1 and BRCA2, but occasionally you find some kind of a different mutation as well, such as P53, and there are other rarer genes which could be associated with breast cancer. And the way to identify that this particular patient needs a genetic test is very much based on the family history. You often find that there are multiple members of the family diagnosed with either breast cancer or ovarian cancer or some other related cancer. Sometimes you can have a syndrome that goes along with bowel cancer as well. So a very detailed family history at the outset is very, very important. And apart from that, women who generally are diagnosed at an early age, so when they're diagnosed with any kind of breast cancer under the age of 50, or if they're diagnosed with a triple negative type of breast cancer at any age, these are all factors that point us towards the probability that this patient is likely to harbor a genetic mutation which has been inherited from the parents. So with this, we then offer the patient a genetic test. And if the patient does then come out to have a positive test, then it does impact on her own treatment, the type of surgery that you offer, the type of medical management that you offer, and the follow-ups as well. They have to be tailored very differently for a person with a genetic mutation as opposed to someone who does not have a genetic mutation. And like the example I quoted before, it makes a huge impact on the family members as well. And this is something that a woman should not hide. I mean, often women tend to hide their cancer diagnosis. But when they have a genetic mutation, it's very, very important to make them understand that they should not hide this fact. They need to inform their relatives, their at-risk relatives, which is generally their siblings, their parents, and if they have adult children as well, they as well need to be informed so that they can take an informed decision if they want to get tested and thereafter be put on very close surveillance so that they can then benefit by early detection and potentially a greater chance of cure.
This makes us realize that how family history is important, how important it is to disclose and to inform our doctors about this, so that, like you said, they can take actions accordingly, they can plan the treatment accordingly. And thank you so much for sharing us the importance of how family history plays a role, and genetic testing can help us in that. But since we're talking about the prevention, screening, and then now the treatment, so what do you think are some of the most promising breakthroughs in breast cancer, cervical cancer, or ovarian cancer treatments we have today?
Okay, so innovations are constantly happening in on the treatment side of different types of cancers. In breast cancer, you have a whole lot of drugs these days for the hormone positive women, for the HER2 positive, and now even for triple negative, there are quite advanced drugs. And I would say like these drugs have possibly been there for about 10 years now, although one or two drugs keep getting added. There's a new sector or a new sort of subtype recognized in breast cancer called as a HER2-low subtype as well, which were previously often just treated like triple negative breast cancers and didn't have too many options. But these days you have particular drugs that help even in this HER2-low segment of breast cancer as well. So that's particularly important for metastatic breast cancer. The other important things, innovations in breast cancer, I would say, are in the de escalation of treatment. So, we have quite a few personalized tests these days, or molecular tests these days, that we can offer women who have early stage hormone positive breast cancer that will tell us whether this patient really requires chemotherapy or not. So, everyone who has a breast cancer does not require chemotherapy. There's a good risk population of breast cancer patients who can have this particular molecular test, which will tell us whether this patient actually benefits from chemotherapy or not. For this cohort of women, a lot of them can be spared the effects of chemotherapy. De-escalating treatment is probably a bigger innovation than inventing new drugs to treat a particular cancer. In cervix cancer, I suppose the biggest innovation in the recent years has been the cervix cancer vaccine. The best way to treat cervix cancer is, of course, apart from doing a pap smear and picking it up early, is to prevent it altogether. We don't have such vaccines for a lot of other cancers, but cervix cancer is one where more than 95% are caused by the HPV virus. And we have specific vaccines now against this high risk virus. But the women have to be educated that there's a very precise time at which this needs to be given between the ages of 9 and 26, where this vaccine is known to be effective and can prevent cervix cancer in the long run in more than 90% of women. Having said that, we advise that those who have the vaccine as well still continue with their pap smear. So that I think is a huge innovation. This is one of the cancers where we've almost gone, we can almost, eradicate it on the same lines as which we've eradicated things like polio, measles, smallpox, etc. You can probably completely eradicate cervix cancer in a few years to come. In ovarian cancer as well, there's a few new addition in terms of drugs. Ovarian cancer, unfortunately, cannot be detected very early because you don't have very effective screening tests. So the only thing you can do is kind of make people aware of the symptoms, and if they are detected, then they get chemotherapy, they get surgery, and if they do have something called as HRD, or they harbor a genetic BRCA mutation, then there are certain other drugs now that we can give them to improve their outcomes. So yeah, quite a few innovative things happening. But like I said, I think the biggest innovation in the recent years has been the cervical cancer vaccine, because that can potentially eliminate it altogether.
I think it's very rightly said that with the help of vaccine which we have for HPV, we can eradicate, and I believe the only cancer for which we have vaccination. So why not to go for it and to educate more and more, so that we can actually, we can only focus on few of the cancers which we can treat it, not prevent it with the vaccine. But yes, thank you so much for shedding light on the treatment options. But also with the AI and technology improving diagnostics, do you think we will soon have some non-invasive screening methods for women cancers, as we know how the clinical trials and research is going every other day? So can we have these kind of methods as well in the coming years?
So AI has been, creating waves, I would say, in multiple fields. But there's a lot of buzz around AI, and the actual, benefits from it. I think tangible benefits have been much smaller than the buzz that has been created around it. Although it is a very, very useful tool. At the moment, I think AI is making some strides in terms of diagnostics. Um, Probably in the future, there will be more involvement of AI in, in possibly reading things like mammograms or a pap smear slide, and eliminate the problems that we have with lack of physicians being out in the periphery. But the screening tests that we have these days, like a mammogram, is it's technically not invasive anyway. It is basically an X-ray. You're not putting in a needle or anything. There have been some other sort of more acceptable forms of breast cancer screening, such as thermography, and there was a talk about a blood test which a private hospital was popularizing based on CTCs and all of that. But those tests have no validation, and as of now, it probably gives women a false sense of assurance. Um, so mammograms are basically non-invasive, and basically, I think the problem is the women don't want to go somewhere to get it done. Like I said, there are a lot of NGOs these days who have buses. In fact, our hospital as well has tied up with an NGO which has a mammo bus, which goes out into the villages, and women just gather, like they would gather for their afternoon chat, and then they would just get a mammogram and get a report straight away. So if the government themselves initiates such, takes the screening method to the women in the periphery, there'll be a lot of uptake. But in the city, I don't think there's any reason why women should not. I mean, they have the luxury of having a hospital in every other street. So in the city, it's just unforgivable if you can't take responsibility for your own health and just take that half an hour in your break to go and get a screening test done. One interesting innovation in cervix cancer, because obviously going to a gynecologist, getting a pelvic examination done is unpleasant for all of us. I know it just takes 5 to 10 minutes, but even if you ask me personally, I would say getting a pelvic examination is a bit unpleasant in order to get a pap smear. So there are again home-based vaginal swabs or HPV vaginal swabs these days that women can do. There are a few FDA approved tests as well. And in India as well, a few of these are commercially available where women can take a vaginal swab themselves. You just go into the bathroom, do the swab yourself, and then you put it in the required container and you send it off for testing. So if they don't want to get a pelvic examination done and there is an availability of the test, they can either post this out or they go to their primary healthcare center and then do the swab yourself there and hand it in. So all of these things are making screening easier and more acceptable to women. Hopefully, this self testing of HPV will become more validated and more widespread. I think in India this would make a huge difference because, like I said, it's a taboo to go to a gynecologist, get a gynec examination done. But if you can do it yourself, and then if there is a problem within the test, then you're more sort of likely to go and get medical attention. So AI can possibly help in this way in reading those tests, and maybe reading it fairly quickly, and thereby women get their answers soon and they can get themselves sorted out earlier. So AI does have some role possibly in the future. You may get more acceptable and quicker screening modalities. So yeah, there is a future in that.
Definitely, I think there's a future in AI as getting the tests done and the diagnosis reports. As I believe, with the help of AI, the things are getting quicker, and it gives us some kind of instant report. But yes, we definitely have to agree to a point that it can never replace human intervention, which is the most required in a medical field. Without that, it won't be possible, I believe. Yeah. So moving on to my next question. We know, Dr. Nandita, that when it comes to breaking the news to a patient that you are diagnosed with cancer, it is very difficult for the doctor as well as for the patient and the family to accept that news. And they go through emotional trauma, and the family also faces that. So how important is to how is important is counseling and the emotional support and treatment, and do we need to integrate more psychological care into oncology?
Absolutely. I think you brought up a very valid point. That is something that we are all lacking, I think, in our healthcare systems. I don't see too many hospitals where they have a setup of a psycho-oncology clinic or specific cancer counselors. So there it becomes the prerogative of the treating oncologist itself to take that role on. Um, I can't speak for everyone, but what I do is the first appointment where I am breaking bad news to the patient. I tend to give the patient at least an hour. I'm sure that is also fairly less, but then practically speaking, doctors spend like 10 minutes at the most in general with the number of patients that they have to see. But that the first appointment is very, very vital, where it's like a make or break kind of a situation for the patient. If you invest an hour at least with the patient in reassuring them, telling the family as well, that they can get through this situation. All they need to is just you know grit their teeth and put up with everything for just a few months time, and then hopefully everything will um, sort itself out. So it's very, very important to invest that time at the first appointment where you're breaking bad news. Because if you tell a patient and then in 5 minutes you say this is your treatment, you're going for surgery, go for your anesthetic checkup, go for your pick line or the port, it becomes very, very difficult from the patient's point of view. They will not actually be even listening to what you're saying. Once you say this is a cancer, that's it. Their mind is going to be blank
Yeah.
for the next few minutes. So you have to turn a psychologist or a counselor for that next half an hour, 45 minutes. And it's probably only at your second appointment that patients begin to actually listen to their treatment options, etc. So that first appointment is only a counseling session. For a busy kind of a clinic where a doctor is not able to spend a lot of time with the patient, it's very important that they have at least a specialist nurse. Patients do open up a lot to nurses. They tend to have a bit of a barrier with the doctor. Sometimes they don't cry in front of you, and then they'll go outside the room, and they'll be crying with the receptionist or something like that. So you feel really terrible when that happens. So again, if you integrate into your system where once you've broken that news to a patient, they then go on to another person where they can have some sort of a continuation of that discussion. A specialist nurse is someone, you can train a nurse to be that counselor. And of course, if you have all the resources, having a psycho-oncologist at that first diagnose, the first breaking bad news, or when things are not going too well, or grief counseling when they're towards end of life, and basically just psychological support through the entire treatment, because treatment as well is not easy. It's easy for us to say take 8 cycles of chemotherapy, take 15 sessions of radiotherapy, but psychologically as well, they need a lot of support right through treatment. And we find in our center that the best way for patients to cope with this is a support group made up of patients themselves. So patients who are through the course of treatment, and patients who've completed their treatment, they are all put into a single group. We put them together on WhatsApp. We have meetings every few months where they can sit and talk to each other. So the best way of one patient deriving support psychologically is from another patient who's had exactly the same experience. How much ever I try to reassure them and give them support, they know that I have not gone through this, so I'll never know 100% what it feels like to have that diagnosis and to go through treatment. So having that support from another patient through support groups is that's very, very vital.
You pointed out very right thing. So when they communicate with the fellow patient and the one who has gone through it, so I believe they get some kind of support. I'm not alone in this. There's some other person also who's fighting through this journey. They are with me. If they can do this, I can also do this. So it's a kind of peer motivation which they get. And definitely then healthcare professionals, doctors, nurses, everyone is there to support them. um, we know that doctors are doing the best job they can, including the treatment option, the psychological care they can provide, including the nurses, the receptionist, or the entire ecosystem of healthcare. So we are very happy and proud of our Indian healthcare sector, of how they are moving forward. They are working day and night to help the patients out there. But still, lastly, I would like to know your message, that what advice would you give to women today, as it's an ongoing series for International Women's Day, to take charge of their cancer risk and overall health, to motivate them to come out of their zone, that they have to come and go for this regular screening. So what message would you give to them?
Like I mentioned earlier, I think in our country, women just don't prioritize themselves. So the message really that I would give women in India, especially, is to be a little selfish. Um, at the end of the day, if you want to take care of your family well, you want to be a good mother, you want to be a good daughter, a good sister, etc., etc., you have to be selfish and make that time for yourself. You have to take time to get screening, to get your regular health checks done. You have to have enough time to exercise. You have to make time to make yourself a healthy meal. And if you count the actual number of minutes that you need to take for yourself every day, it's probably not more than 30 to 45 minutes. I'm sure you can do that. Don't you skip your tele series, your Netflix series, or your television serial for a day, and take that time for yourself. So be a little selfish, especially when it comes to your health. Prioritize your health, and that's the only way that you will be productive, and on the long term, that's the best message you will also give your children as well. They will also take that, and moving forward will be more careful about their own health. So to be selfish, prioritize your health, your exercise, do everything that you can to prevent health problems, not just cancer, but any health problems for that matter. um, so yeah, I think a little focus on yourself goes a long way in preventing a lot of diseases and keeping yourself and your family healthy and happy.
Thank you so much, Dr. Nandita, for sharing your valuable insights with us. It means a lot, as with you, we are here to create that awareness, to educate them, to motivate them, to take their health seriously. Like you said, we need to be a little selfish for our own health, so that our family can be healthy. Because we know if a woman gets something, the entire ecosystem gets disturbed. And for them and for us, we need to take care of our health. And thank you so much for sharing your expertise with us, for sharing your case studies and the you know this examples of how early prevention can help us go a long way in reducing the complexities. So thank you so much for coming to our platform and giving your time with us.
Thank you. It's been a pleasure, and I think it's a very good initiative that you've taken on to build up awareness for International Women's Day. I think there's no better thing that you could have done from your end as well. Thank you.
Thank you so much.
Bye bye.